Hello and welcome. Today we're diving into a rare and fascinating heart condition known as PRKAG2 syndrome. This genetic disorder primarily affects the heart, but its impact can extend to other parts of the body. Join us as we explore the causes, symptoms, diagnosis, and management of this complex condition. PRKAG2 syndrome is caused by mutations in the PRK2 gene. This gene provides instructions for making a subunit of an enzyme called AMP, activated protein kinase, or AMPK. AMPK acts as a cellular energy sensor, playing a crucial role in regulating metabolism within the heart and other tissues. Mutations in the PRK2 gene disrupt AMPK's normal function, leading to the characteristic features of the syndrome. These mutations are often inherited in an autosomal dominant pattern, meaning that only one copy of the mutated gene is sufficient to cause the disorder. However, new mutations can also occur spontaneously, meaning that a person with PRKAG2 syndrome may be the first in their family to have it. The heart's usual energy and structural processes are disrupted by the flawed AMPK enzyme. Primarily, excessive glycogen accumulates in the heart muscle cells, called cardiomyocytes. Glycogen, a form of stored glucose, builds up abnormally. This leads to an increase in the size of the heart, a condition known as cardiac hypertrophy. This enlarged heart muscle, especially in the ventricles, struggles to pump blood effectively, resulting in heart failure. Additionally, the abnormal glycogen storage disrupts the heart's electrical system. This disturbance causes various arrhythmias, including Wolff-Parkinson, White syndrome, atrial fibrillation, and other irregular heart rhythms. These arrhythmias can be life-threatening and often require intervention. PRKAG2 syndrome is a rare genetic disorder, and precise epidemiological data is limited. Due to its genetic nature, it affects individuals of all ethnic backgrounds. However, the actual prevalence of PRKAG2 syndrome is difficult to determine, as it may be underdiagnosed or misdiagnosed, because it shares some clinical features with more common cardiac conditions. Studies suggest it accounts for a small, but significant, percentage of unexplained cases of hypertrophic cardiomyopathy and pre-excitation syndromes. The signs and symptoms of PRKAG2 syndrome can vary significantly from person to person, even within the same family. Common symptoms include shortness of breath, fatigue, dizziness, and chest pain, particularly during physical exertion. Heart palpitations, a sensation of a rapid or irregular heartbeat, are also frequently reported. Many individuals with PRKAG2 syndrome experience heart arrhythmias, which may manifest as sudden episodes of rapid or irregular heartbeats. In some cases, the first indication of the condition might be sudden cardiac arrest. As the disease progresses, heart failure can develop, leading to fluid retention and swelling in the legs and ankles. Diagnosing PRKAG2 syndrome requires a combination of clinical evaluation, electrocardiography or ECG, echocardiography, and genetic testing. An ECG can reveal characteristic features like Wolff-Parkinson, White syndrome, or other arrhythmias. An echocardiogram can show signs of cardiac hypertrophy. However, the definitive diagnosis is usually made through genetic testing, specifically by sequencing the PRKAG2 gene to identify any mutations. Because of the familial aspect of the disease, family history is an important element. If a family member is diagnosed with the syndrome, other members should be screened, even if they do not have any symptoms. PRKAG2 syndrome does not have subtypes per se, but its presentation is varied. Some patients may primarily exhibit arrhythmias, while others may present with significant cardiac hypertrophy and heart failure. The age of onset and severity of symptoms can also vary considerably. The treatment of PRKAG2 syndrome focuses on managing the symptoms and preventing complications. Antiarrhythmic medications may be prescribed to control irregular heart rhythms. In some cases, a procedure called catheter ablation may be performed to eliminate the abnormal electrical pathways causing the arrhythmias. For individuals with heart failure, medications such as ACE inhibitors, beta blockers, and diuretics may be used to improve heart function and reduce fluid retention. An implantable cardioverter defibrillator, or ICD, may be recommended for individuals at high risk of sudden cardiac arrest. Lifestyle modifications, such as avoiding strenuous exercise and maintaining a healthy diet, are also important. Currently, there is no known way to prevent PRKAG2 syndrome, as it is a genetic disorder. Genetic counseling is recommended for families with a history of the condition, particularly for individuals who are planning to have children. Genetic testing can help determine the risk of passing on the mutated gene to future generations. Early diagnosis and proactive management of symptoms can significantly improve the quality of life for affected individuals. The prognosis for individuals with PRKAG2 syndrome can vary widely, depending on the severity of the condition and the effectiveness of treatment. With appropriate management, many individuals can lead relatively normal lives. However, the risk of sudden cardiac arrest remains a concern. Recent research is focused on developing targeted therapies that address the underlying mechanisms of the disease. Some studies are exploring the use of gene therapy to correct the PRKAG2 mutation. Other research is investigating potential pharmacological interventions to reduce glycogen accumulation in the heart. These advancements offer hope for improved outcomes for individuals affected by PRKA2 syndrome.